Does your child have a feeding problem? Is your child not growing fast enough? Is he a picky eater? Would he rather play than eat? If you answered yes to any of these questions, then you and your child may be dealing with a feeding problem. Thankfully, the Medical City has the solution. Introducing the Medical City's Feeding Clinic, an institutionalized service created by TMC's Center for Developmental Pediatrics to address the whole spectrum of feeding difficulties of children from 6 months to 8 years of age.
The prevalence is just staggering. 60% of Filipino mothers complain that their child is hard to feed. Why are we concerned? Aside from the fact that there's suboptimal intake of nutrients or the fact that they may have an underlying illness, the implications go beyond physical growth. There's an emotional and a cognitive implication. Studies have shown that children who are always being force-fed have less touching, hugging behavior with their parents because of the high maternal intrusiveness that is child withdrawal. Studies also show that there is a delay in mental developmental index scores in children who are hard to feed compared to controls.
TMC's Feeding Clinic is the first of its kind in the country. It is staffed by a team of medical professionals, doctors, nurses, and therapists who have been specially trained to diagnose and treat the most common to the most severe feeding problems. The clinic provides a comprehensive approach to deal with children with feeding difficulties. Here, the feeding patterns of children and their primary caregivers are screened and monitored using the I Am Fed method. If a problem is diagnosed, parents and caregivers are counseled and encouraged to attend parent classes on proper feeding. The classes become instrumental in making patients and parents TMC's partners in the management of the feeding problem. For more extreme cases, a comprehensive evaluation of the situation is done. Gastroenterologists, nutritionists, dietitians, pediatricians, and other specialists all come together to assess the patient and to propose a plan of treatment. This unique, multidisciplinary approach ensures that patients get the highest level of expertise and care. So if you think you might be dealing with a feeding problem, don't hesitate to call or visit us. We at the Medical City's Feeding Clinic are ready to guide you and work with you to overcome any feeding problems your child may have.
If your child is hard to feed, picky, fussy, hyperactive, would rather play than eat, is highly selective, or has a fear of feeding, have your child assessed at the Feeding Clinic, Center for Developmental Pediatrics, the Medical City, where patients are partners.